Welcome back everyone. Today we are diving into one of the most critical yet sometimes underestimated aspects of clinical medicine, communication. This session focuses on communication, counseling and patient education. Essentials not just for the AMC Part 2 exam but also for everyday medical practice. Let's get started. What's the importance of communication? Communication is at the heart of everything we do as doctors. It's how we build trust, make accurate diagnosis, explain treatments, and guide our patients. Good communication enhances compliance, strengthens relationships, and improves outcomes. On the other hand, poor communication is one of the leading causes of malpractice claims. In the AMC Part 2, your communication skills are being assessed at every stage, not just when you greet the patient. What are the modes of communication? There are 3 key modes of communication to keep in mind. Verbal communication includes your language, tone, clarity, and pace. Nonverbal includes body posture, facial expression, and eye contact. Even silence has meaning. Lastly, written communication like discharge summaries or referrals is less emphasized in the AMC but still essential for safe patient handover and coordination. What are the communication challenges? Now, not every patient encounter is straightforward. You may work with patients who are hearing impaired, don't speak English well, or are unconscious or cognitively impaired. Interpreters and nonverbal cues become crucial here. You will also face cultural and linguistic diversity, so cultural competence and ethical clarity, especially around consent and third-party communication, are vital. Verbal communication in AMC. In the AMC exam, clear and jargon-free language is a must. Think, how would I explain to this a friend who has never studied medicine? Tailor your language to the patient's level. If you are too technical, you lose the patient. If you are too vague, you risk misinformation. Nonverbal communication. Nonverbal communication speaks volumes literally. A warm smile, eye contact, leaning slightly forward, these all show empathy and interest. But be careful. Cultural differences mean that gestures or even eye contact may be interpreted differently. So be observant and adaptable. Effective communication builds. When you communicate well, you are not just sharing information, you are building rapport and mutual understanding. That leads to a better trust, which increases compliance. Patients are more likely to follow a treatment plan if they feel heard and respected. History taking skills. There are 2 approaches to history taking. Non-directive or open-ended questions let patients tell their story. This builds rapport. Then you use directive, close-ended questions to narrow down specifics. A good strategy. Start broad, then funnel in, and always watch for emotional cues. Listening and facilitation. Listening is more than hearing. It's about showing the patient that you are present. Use prompts like, "Tell me more," or "Go on." Silence is also a tool. Sometimes just giving space leads to a valuable information. At the end, summarize what you've heard to confirm understanding. Patient education principles. When educating patients, use both medical and layman's terms. Correct any misconceptions that may have gently. Don't overload them. Use diagrams, analogies, or visual aids if available. And check for understanding. Don't assume it. Ask them to explain it back to you. Giving advice and treatment. When giving advice, be clear about the treatment name, dose, side effect and how long it will last. Explain what they can expect and what to do if side effects occur. Always clarify the follow-up plan and include any preventive advice. Patients need clarity and reassurance. Counseling in clinical practice. Counseling comes in two flavors. Directive counseling is when you give firm advice. Non-directive counseling allows the patient to choose while you support and guide them. In both cases, active listening and non-judgmental support are crucial. Educate them, but empower them too. Common counseling scenarios. You will commonly face counseling scenarios like smoking cessation, alcohol misuse, eating disorders, or grief. These are sensitive topics, so your tone, body language, and words all matter. Be respectful, empathetic, and professional. Practice handling these conversations beforehand then. Assessing communication in AMC. In the AMC exam, communication isn't a bonus. It's a core competency. You will be evaluated on your ability to show empathy, explain clearly, obtain consent, and educate effectively. Even if your clinical diagnosis is spot on, poor communication can cost you points or even the station. Key tips for AMC candidates. So, here are some golden rules. Be empathetic but conscious. Avoid medical jargon. Always acknowledge patient concerns. Encourage questions. Adapt your style to each patient's need. And maintain professionalism throughout. These small things make a big difference. Conclusion. To wrap up, communication isn't just soft skill fluff. It's as essential as your clinical knowledge. Mastering it not only boosts your exam scores but transforms your effectiveness as a doctor. Good communicators make better clinicians and more satisfied patients. Final takeaways. Let's end with some key reminders. Build trust. Use both verbal and non-verbal tools. Educate, reassure, and support your patients. And above all, communicate with compassion and clarity.